IV cannulation, and IV cannulation, as you know, there are 70 to 80% of the patients are getting IV cannula in a hospital. All hospitalized patients, if you see, there will be a cannula. And when the patient goes from the hospital during the discharge, they say good if they are not getting pain, if they don't have a phlebitis, if there will be no pain for the patient. If there is pain, then that will remember the whole days, how long the patient is there in the hospital, they will not remember that. But if there will be phlebitis, there will be pain, there is swelling, that they will remember, and they will circulate among their friends and everyone. So it is in your hand, it is the student's hand, it is the nursing staff's hand, how you are going to taking care of the patients through the infusion therapy, through the IV cannula, through the central line. So thank you all, and hope you all will enjoy those sessions and you will learn many things. And whatever you will learn, please go to your hospitals and practices so that we can go for a patient safety and we can take care of our patients nicely. Thank you. Thank you.
Thank you so much, ma'am. Now I request our chief guest, Professor Dr. Vijay Kumar Mahapatra sir, to kindly come over and speak a few words. So please.
Samastam Namaskar. Very nice to be a part of. Once last year, probably I came for one quality assurance workshop. And I was going through the components of your Skillathon. And as previously Madam was telling, the skill of the nurses. Gone are the days when the nursing fraternity was confined to services of the nursing faculty, was confined to changing the bed sheets and administer the drugs as advised by doctors in the round. Why I am telling, if you go by the availability of doctors as far as our population is concerned, if anybody is aware of Indian public health standard, we need to have one like bed and doctors. We need to have one bed for 1,000 population. And national health policy, we need to have 2 beds per 1,000 population. At present, what is the bed population ratio? Anybody knows? It was 0.34, now it has gone up to 0.74. Our aim is up to 1. But when you increase beds, the availability of the skilled HR should be proportional so that the service delivery will be proper. And if you go to the highest level of service providers, that is doctors, that is around basic level vacancies at a global level is around 50%. And when you talk about specialists, that is around 60%. And to lower the burden of the doctors when they should be engaged into treating patients and advising, the most important hierarchy who takes care of the patients is the nursing fraternity. When the supervisory and capacity of the nursing faculty increases, the load becomes down on the doctor, and there is quality of care improves. Nurses is not only, we need to, you are the team leader. If the quality thing is concerned, you are the team leader, under you many people they work, you carry out the direction, but you see the patients for the whole period. And there is a need to prioritize the requirement of the patients. there are 20 patients under my control, probably in a bed, in a ward. I need not focus my attention on 20. I need to categorize my patients 1, 2, 3, 4. Number one category of patients, they need to be 24 into 7 under my observation. And for that prioritization, the skill is needed, and these orientations. Earlier days, there was no continuous education, no sensitization and quality, nobody bothered about anything. And probably people thought the quality is an additional thing. We have got so much work, we cannot focus on quality. But they forget to understand that the quality, when you improve your quality, all the jobs you are doing, it will be proper. And that should be the aim of every, not only nurses, pharmacists, laboratory technicians, radiographers, everybody, even doctors, everybody. Why councils are stressing on continuous medical education and points accumulated so far that registration will be renewed. We need to upgrade ourselves. I was happy that you have kept that IV cannulation for nursing students. Small things, if it is not done properly, then a lot of complications. And we need to provide quality care. And for imparting quality care, you need your skill to be updated. I am very thrilled to be a part of an inauguration ceremony for a workshop which takes care of the critical things. Please remember, you may be working at you may be working at Kalinga, you may be working at Apollo Hospital, you may be working in a remote field, but wherever you work with quality. Because when we want some services from any sector, we ensure that we will get qualitative service. Forget about healthcare. Every small thing in your life, you impress on quality. If you are going to buy a new sari, you look for quality. You want to have a trouser and shirt, you need quality. You want to buy a mobile, you impress upon quality. You want to have a goggles, you need quality. If we are stressing on quality, let us qualify ourselves so that the service delivery to the people under us will be qualitative enough. And especially the job of the nursing, now everybody understands that the most important component of hospital-based care is nursing. And now, as per Government of India mandate under comprehensive primary health care, even nurses are assigned the role of a community health officer to impart quality care, which is little above than the auxiliary nurse midwives. I had been to Dubai for an exposure visit. I saw my fellow doctors, they are very relaxed. Because the nursing sister who is there, she is so sharp and focused enough to apprehend any complication of the patients, maintains the parameters, analyzes the parameters, and gives the feedback to the doctor. Sir, your intervention is needed. And we have to have that sort of skilled nursing manpower in our society. Hope this 2 days workshop will go a long way. Be active, always ask questions, always fight among yourselves to do a procedure. As Madam told, theories are many, practicals are really important. We know how to give a cannula, but when you go and push a cannula, you understand the difference between the theory and the practical. All the best for the 2 days workshop. Thank you.
Thank you so much, sir. We are honored by your presence and grateful for the message you have delivered, especially emphasizing on quality of nursing care. Next, I would like to introduce our chief speaker, Dr. Vishnu Prasad Mahapatra sir, to kindly come over the dais and share a few words of wisdom with us. So please.
No, sorry. Namaskar, respected chief guest Vijay sir, Superintendent Sam Hospital, Dr. Samantha Singer, and other distinguished guests on the dais, distinguished guests, and my dear nursing professionals from different hospitals. I have very bad throat because I was suffering from viral fever, so please bear with me. Actually, I thought I could not attend today, but I could not refuse the invitation from the Nursing College of some hospital, especially Superintendent of some medical college. So I was compelled to attend today this meeting. At the outset, I salute all of you, sorry, all the nursing professionals, because you belong to one of the noblest professions. I always appreciate, as a doctor, I always appreciate the work of the nurses, because without a nurse, we cannot imagine the health system. And in a health ecosystem, the skills of nursing professional is very important. And we have seen in many countries, nursing professionals manage many more things than they do in India. So, because to work with less number of doctors, we have to upgrade the skills of nurses regularly and periodically. There is no other alternative. In this Skillathon, you will be trained on hard skills. You might be thinking, what is hard skills? Whatever you have been taught in the colleges, and whatever you will be taught in next 2 days, these are all hard skills. Because your technical skill, how to give a cannula, all these basic, because your central line management, intravenous cannulation, these are very basic things required for the patient safety, quality health care, as already sir has told. So these are, you can learn from books, you can learn with mannequins, you can learn from colleges, hospitals, but these are all hard skills. I want to also emphasize on soft skills. Because without soft skill, we cannot grow, we also cannot excel in our profession. Then what are the soft skills? Along with hard skills, soft skills should also be taught. Soft skill is one. I will also only emphasize on one or two soft skills. One is communication. So communication is very important in all the professions, even in the home. If you analyze, then you can see any issue, any problem, starting from domestic problem, samistring of alito arambo kariki, to the world war. All these things happen due to communication gap. And most of the time, we don't communicate properly. We think that if we speak for 1 hour, 2 hours, then we are a good communicator. That is not the fact. And in health professionals like doctors, nurses, especially because we are dealing with the patients directly. So in case of doctors and nurses, communication skill is very much important. And to be a good communicator or to be a good counselor, you have to be a good listener. So if we don't have a attitude to listen to others, we always think that we should speak and others should listen. I always tell in the trainings of doctors also, we should try to learn to listen to others. As a doctor, as a staff, as a nurse, we should try to listen to others. If you listen to a patient, then patient is satisfied and patient tells that doctor or nurse has listened to me. If you don't listen, then patient goes home and tells that doctor has not listened to me, whatever I have started telling my problems and he has already prescribed the medicine. Or nurses, when I try to speak to a nurse about my problem, already nurse is not ready to listen and nurse is trying to impose something on me which I don't require. So, when you listen to a person for 1 hour or 30 minutes, and then your job is very simple and easy. You can sort out the problem with 1 or 2 sentences because you know everything from the patient. So you know what is required, what the patient requires. So that's why I will request all of you to listen to the patient empathetically. And because empathy is also another soft skill. We have to keep ourselves in the position of the patient and feel their agony, feel their pain, so that and share their feelings, so that we can treat and manage the patient properly. In all the cases, medicine may not be required, but your consolation, your empathy matters a lot to the patient. And as I was saying, listening is an art. ଆପଣ ଯଦି ଗୀତ ଗାଉ ବାଜା ବଜାଉଛନ୍ତି କି ଡୁବତବଲା ବଜାଉଛନ୍ତି, then you have to make riyaz. Every day morning you have to get up and do practice. So you have to also do practice to listen. I guarantee that if you start practicing to listen, first day you try to listen for 5 minutes, then after 5 minutes your patience is over, you try to speak. But it is not so easy to listen to others. It is very easy to speak, not easy to listen to others. So listen to others, counsel, communicate properly, and communication may be verbal and non-verbal. Body language matters a lot. ଆପଣ କାହାକୁ କହୁଛନ୍ତି, what is your body language, that matters a lot. Patient can feel that whether you are really concerned for the patient or not from your body language. Only words are not sufficient. Your body language also should be sufficient to treat the patient. So another thing is, as a team leader, most of the time, because you are in the emergency, doctor is not there, you have to be a decision maker. That is also a soft skill. You have to think critically. That is also a soft skill. You have to build your team building. That is also a soft skill. So without these skills, only with hard skills, we cannot excel in the profession. So my humble submission will be, the teachers of nursing colleges should also try to inculcate these soft skills in the students of nursing so that they can grow in their profession. I expect, because I am not well, I'm not able to speak more. I expect that these 2 days deliberations will go a long way to for growth of your professional profession, and you will gain a lot from this 2 days training program. I am thankful to the organizers for inviting me to this occasion. Thank you very much.
Thank you so much, sir. Despite of your health conditions, you have joined us today. Your words have truly inspired us a lot, especially the importance of soft skill in both our professional and personal lives. Next, I humbly call our guest of honor, Professor Dr. Pushparaj Samansingar, sir, Medical Superintendent IMS in some hospital, to kindly share a few inspiring words with us. Sir, please.
Very good morning. My namaskar to all of you. Esteemed dignitaries on the dais. Dr. Vijay Kumar Mahapatra sir, Special Secretary, Department of Health and Family Welfare, Government of Odisha. Dr. Vishnu Prasad Mahapatra sir, Additional Director, SAS, Government of Odisha. Our Director, Nursing SOA, Prabhati Madam. Nursing Superintendent Nidhi Madam, Additional IMS, Subha Madam, and Sudhamini Madam, Nursing Superintendent, Care Hospital, and all esteemed faculties, guests, and delegates. Our NS Sam Ultimate Madam, she is there, and Millie Madam, and PRM Dr. Lingaraj, Dr. Magani Vera, and Dr. Kalpana Maji, and dear friends, this is extremely auspicious. बहुत पवित्र दिन, बहुत पवित्र टाइम भी चलती पर दिन आमर श्री गणेश चतुर्थी थिला काली आमर गत काली नुआखाई जुआर एवं आज ये जो 2 दिनिया कर्मशाला नर्सिंग स्किल अपग्रेडेशन लगी. So this has to be extremely good fortune for all of us. We are also indeed very happy that such pioneers of from the health department and those who are at the forefront of implementing the ideas of the policies of the government, they are here, and from their views, their ideas, a lot to learn. What जोटा सर मैंने कहले से बहुत जिन किसी शिखार अच्छे से मुझे देखुली आम NABH भी एक्जाक्टली से कथा कहते NABH जो लेटेस्ट एडिशन देखिए से लॉट ऑफ फोकस ऑन कम्युनिकेशन एंड सॉफ्ट स्किल मुझे गोटे स्टेप अहेड जब आम जाकि देखा जोटा नर्सिंग कॉलेज रे बहुत थोड़ा डिस्कशन भी होती आमर AI ऑल आर टॉकिंग अबाउट AI एंड हेल्थ केयर AI एंड बिग डाटा एंड AI इज गोइंग टू रिप्लेस medical science to some extent. It will reduce the load on doctors. To ask me, AI will only prove the importance of skill of the doctors and especially the nursing staffs. AI is here to show that there is nothing that will ever replace nursing knowledge and skill. So, Vartavan, this opportunity, I would like to congratulate the nursing department for doing this program. This will indeed help our nurses all from all over the state to increase their skill. Apanamankar skill to सबुठ important है लगे अपनकर दीटा जिनसो जोटा सर माने भी कहते your silence and your smile will be enough to take care of all the sufferings that the patient has. Patient रो सबू कष्ट दुख आपणकर से साइलेंस और स्माइल रे अब्जर्व हो जिवो एटा ही समस्तकर माने मोर भी तो बहुत बड़ा wish and that God may make it true that apart from skill is one part, but after some time it is the divine power that will come into play to cure the patient. So आपण मानको बहुत बहुत धन्यवाद. You have come here and joined this program. We are always we design our programs in such a way that the best education, continuous nursing education is done in IMS hospital. I also congratulate the office bearers of INS. This is the first Skillathon in the state. Congratulations, madam. And definitely this program will help you to be better nurses, to do more justice to the patients, and hopefully the patients will always smile when they are treated by you. बहुत बहुत धन्यवाद. जय जगन्नाथ. नमस्कार.
Thank you so much, sir, for enlightening us with your valuable insights. With great respect, I would like to invite our guest of honor, Professor Dr. Prabhati Tripathi ma'am, Director, Some Nursing College, to kindly share a few words and enlighten us. Ma'am, please.
Very good morning, one and all. Dignitary on the dais, Vijay sir, Vishnu sir, and Prithviraj sir, Minati madam, Sobha madam, and Saudamini madam of the dais, Aisha madam, Milli madam, Pragat sir, and Kalpana madam, and others. So, this is a great opportunity to speak about nursing profession and their skill. So, whatever our guest spoke about, that nurses require skill, and I will add that with the skill and with prompt action, we can be recognized by our professional things, standards. So, at the outset, I congratulate for the Skillathon of this is first of its kinds in our state, organized by Madam Sobha in IMS Hospital. So, thank you, Madam, for giving this opportunity to nurses of this state of Odisha. So, this is our pride that this type of skills stations are conducted by IMS Society India. So, it is very required that this therapies or catheter or IV things. So, first hour, this whatever it is written there. So, we aim for our patient outcome or patient satisfaction, and with the proper skill, we cannot achieve that. So, first require skill. Obviously, knowledge is required, but with knowledge we cannot do anything. So, what's that told that AI cannot replace the skill of nurses or doctors' skill. And that is very true. And what we observe that there is a difference in the nurses of abroad and here, that is only the skill and the prompt action and decision making things. So that can be acquired by our attitude and to learn continuously. Otherwise, we'll be lagging behind and par with other professional things. So our standards only depends on our skill. So I wish this type of workshop, this type of skill things will enhance your power to give best to our patient. And we know how the bad experience patient takes when there is a repeated insertion, repeated pricking, and it's very difficult to the patient to tolerate that repeat things. So they don't like that nurse or they don't like that doctor when they repeat the things. So this is and that complication also remains in their mind. So I think this type of skill things in our by delivering the proper skill to our nurses, it will improve their skill and enhance their capacity to deliver proper practice to the patient, so the patient will be satisfied and our patient outcomes will be good, and will be prompt in our action. So this Skillathon, whatever they have thought to impart here, it is good of their kind and idea. So thank you, the society, thank you, madam. So I wish all of you learn through these 2 days, and whatever you like to learn or whatever they are doing, so everything you try to achieve and acquire so that you can practice in your field. So thank you all.
Thank you so much, ma'am. We deeply appreciate your encouragement and blessings. Next, I would like to request our nursing superintendent, Madam Mrs. Minita Mishra, to kindly share a few words with us. Ma'am, please.
Very good morning, one and all who are present over here. Respected and most esteemed personalities, Chief Guest Dr. Vijay Kumar Mahapatra Sir, Special Secretary, Department of Health and Family Welfare, Government of Odisha. Chief Speaker Dr. Vishnu Prasad Mahapatra Sir, Additional Director, State Health Assurance Society, Odisha. Guest of Honor, Professor Dr. Pusparaj Samanta Singha, Medical Superintendent of IMS and some hospital. Professor Dr. Prabhati Tripathi, Director, some Nursing College, Shoa University. And Additional Nursing Superintendent, Subhamanjari Samal, Nursing Superintendent of Care Hospital, Sodamini Madam, Maguni Sir, Dr. Ratha, Monalisa Madam, Ushti Sir, Kalpana Madam, Aisha Madam of Ultimate, Millie Madam, and all my lovely nurses from different hospitals. All dignitaries have already explained about the value of nurses. By that, are you feel proud that you are a nurse? Yes. Really. I also feel very proud that I am a nurse. I am a ISU nurse. And now also I am so much of confident and skill that I can manage a critical patient independently. I have that much of a skill. And by nursing care, that the hospital is if getting fame and name, if the nurses are skilled, if the nurses are compassionate, providing compassionate care to the patient. When patient is leaving, they are giving feedback. And our medical superintendent always telling that if patient hospital is getting fame for nurses only, and if hospital is getting blame for nurses only. That feedback is solid.
Nurses are good, feedback is good. Nurses are bad, feedback is bad.
Exactly. So if we have to be very skilled and we have to be very knowledge. And already Vijay Mahapatra sir already told that day is already gone. When nurses were only involved in spreading the beds and going down with doctor rounds with the register and BP instrument. Already that day is gone. We are all educated and registered nurse. And we have lot of experience and skills should have to provide nursing care. So it is my privilege and honor to express this topic about the management of IV cannulation and central line. It is a indispensable tool to provide critical patient, and when patient is serious, patient is getting lot of infusions, medicines at a time. That time peripheral line is not sufficient to provide sufficient care or adequate care. So that time we are preferring central line. But if we will not maintain meticulously, that all the problems will arise. Mainly that class shift, everybody knows. And that recent global study says that due to class shift, that it is increasing the morbidity, cost of the patient, treatment, length of stay in the hospital, patient is getting frustrated, and hospital is also losing revenue. So in the root, the nurses are the main. And each procedure, nursing procedure, nurses are involved and associated. That we should be very confident. And how that confidence will come? By training by hands-on. For which that Polymed has arranged this one. I extend my thanks to that Polymed, Mr. Siddhartha and Anki. And in this workshop, hope that we will learn so much of things and we will provide better, excellent nursing care to our patient. We are working in different type of patients are coming and different serious type of patient also coming to us, and we have to be very compassionate and have to provide better nursing care. We are facing a lot of problems, that manpower, lack of perfect training. Still, we have to be very compassionate and have to provide nursing care to our patient. Thank you all. Then hope that you will enjoy this session and will implement in your clinical area. Thank you.
Thank you so much, ma'am, for your motivating words. It really means a lot to us. Next, I would like to request our honorable guest of honor, Madam Mrs. Sodamini Sahu, Nursing Superintendent, Care Hospital, Bhubaneswar, to convey a few valuable messages to our audience.
Thank you, Kira. I wish a very good morning to one and all present here, and our distinguished guests who are present here, Dr. Bijay Kumar Mahapatra sir, and Dr. Vishnu Prasad Mahapatra sir, and our guest of honor, Pushparaj sir, and Madam Prabhati, Minati Madam, and our IMS City Chapter President, Madam Sobha, and all my senior professionals and my all juniors and friends here. So we welcome you for the INS Skillathon, which is going to happen for 2 days. Are you all excited? Excited? Yes. Okay. Keep this energy throughout the day and learn, because there are a lot of efforts has been gone through to organize this. So I would like to thank for this our Sobha madam and all her team of IMS, the training team, who was continuously following with everybody for registration, for their PPTs and everything. So thank you so much, Sobha madam and the team INS. Please clap for them, because they have taken a lot of effort to organize this. So please use this opportunity.
Madam, it is my organization.
I will tell you about sir also. And definitely, Pushparaj sir, I always find him very much encouraging. And here we see the integration of education and as well as clinical. So do Prabhati madam also is here. I would like to tell you that this INS is organized. You all are skilled people, not mean that you are not skilled, but it is important that we always revision our skills and learn new things. Whenever such type of conferences and skillathons happens, you will come to know a lot of new things, new learnings. So use these opportunities fully. Enjoy whole day, learn more. As sir has said that you need to be more good communicative. Vishnu sir, to ask questions. There are 5 skillathon workstations are there. You communicate with your faculties and learn from them. Along with that, I would like to say all of you that participate fully and enjoy the day and learn more. Thank you so much.
Thank you so much, ma'am, for encouraging us. We are grateful for your blessings. Next, I would like to request our Honorable Medical Superintendent sir to kindly come forward to felicitate our Chief Guest, Professor Dr. Bijay Kumar Mahapatra sir.
I'll just leave after listening to all of them. Way back in this teaching and training, as Vishnu told, I believe that nurses are the best mentors in field. Way back in '83, there was no IV cannula, there was scalpels. An emergency patient came, and I was giving a scalpel when the patient was sitting and holding hand like this. And one of my senior staff nurses was there. She told, "Hey, poor, swa, hato siddha kar." At that time of that level, whatever she was to guide, she was guiding. Again in '86, I remember that staff nurse of Safdarjung Hospital. I was a junior resident. The first day, because we are not so much exposed to practical things in our internship, so she told, "आ जाइए डॉक्टर साहब, episiotomy करना." So I told, "I have not done it. मैं माँ के पेट से सीख के आएंगे, आइए." And she virtually guided me how to inject, how to do a episiotomy, and how to deliver. So do not think yourself as mere spectators. Lead a team, educate everybody. Thank you.
Next, I would like to request our Honorable Professor Dr. Prabhati Tripathi ma'am to kindly felicitate our Chief Speaker, Dr. Vishnu Prasad Mahapatra sir. I request our audience to kindly give a big round of applause. Next, I would like to request Madam Mrs. Sodamini Sahu, Nursing Superintendent Care Hospital Bhubaneswar, to kindly felicitate our guest of honor, Professor Dr. Pushparam Samant Singhar sir, Medical Superintendent IMS Hospital. Next, I would like to request Madam Mrs. N. Aisha ma'am, Chief Nursing Services, Some Ultimate Bhubaneswar, to kindly felicitate our guest of honor, Professor Dr. Prabhati Tripathi ma'am. Next, I would like to request our respected Deputy Nursing Superintendent Madam Mrs. Kabri Rani Sahu to kindly felicitate our Nursing Superintendent Ma'am, Minati Mishra ma'am. Next, I would like to request our respected Nurse Quality Manager Ma'am, Mrs. Sangamitra Mishra ma'am, to kindly felicitate our Additional Nursing Superintendent Ma'am. I request our audience to kindly give a big round of applause. Next, I would like to request our Honorable Deputy Nursing Superintendent Madam Mrs. Nirupama Dagar to kindly felicitate our guest of honor Madam Mrs. Sodamini Sahu. Ma'am. Thank you so much, ma'am, sir.